Good, 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 good. Here we go. Right, good. I think we're in. Good evening, everybody. Welcome to another Facebook Live in the group. Please say hi. Let us know where you are. There's been a lot of interest about tonight, Julia. Great to see you again.
Oh, it's lovely to see you. It's always good. We always run out of time, run out of chatting time, don't we?
Well, that's why we're a bit late coming in because we were
Yes,
guessing away. We were
exactly,
guessing away.
exactly.
Well, I'm really looking forward to this on many levels. And we were talking off there, Julia. So the wonderful Sindor's over from India. So
Oh,
hi, Sindor, if you're tuning in. And you got to see her at the weekend. I got to see her
yes,
on Monday. And we were saying this. There's for those who are kind of humble enough, I think, to want to be keeping the dog in focus.
mm,
There is a real spirit of collaboration that's going on. But we're all recognizing we all
yeah,
need each other really to pull these
definitely.
strands to try and understand the
Mm,
individual lived experience of these wonderful animals.
mm.
And of course, with Galen Myotherapy, that's always been at the heart of what you wanted to do from the get-go, isn't it?
Totally. We've always, I mean, from the moment I started it all those years ago, it's been completely dog centric. It's all about what we can do to help the dog. And I think a lot of that is obviously comes back from the original dog that sort of really inspired this, but also my own personal soft tissue discomfort and pain. So I know how profound it can be. And I also know how dogs hide it. So to get that inside track on appropriate observations has been something that's been very passionate at the very heart of everyone at Garland, because we've attracted people, very like-minded people, and all our therapists are the same, and our students, which is wonderful. They want to make a difference to dogs, and really there's nothing like observations, is there? Whatever you're looking for.
And that's the big point of tonight, really. And I think that we can agree. I think that we need more spaces to learn about how to do really good observations, and that does
Yeah,
mean checking in our own biases
yeah,
and trying to move away from the, instant labels and judgments and just allow ourselves to feel what we see.
exactly. And trust ourselves too, absolutely that. But I mean, there are so many things that we observe, and of course, as time's gone on, because I've seen so many of the same things, that the knowledge has embedded more and more and more. So then you can layer it, can't you? So you think, yes, I'm happy with that. Right, now let's take it on to another layer. And I suppose posture is one of those. And I know a lot of people say, oh, yeah, I know about posture. And great if you do, but it is so nuanced that, I mean, I've been studying it really quite intensely, quite geek like actually, for, well, nearly 20 years. So it was a few years into starting that I realized that there was postural changes. So that's just one of our observations. Yeah, posture. It really does unwrap those physical secrets, I think.
And I think one thing with posture, we're going to be looking at we're going to use one of my own dogs actually as
Yeah,
a case study today, but it's allowing ourselves also to allow our eye to be to draw our eye away from some of the obvious stuff
yeah,
because we can get pulled into that and think, oh yeah, I've seen that
totally.
and that's where I'm
Mm,
going to stop now.
mm, absolutely. And as I said, it is really nuanced. So we are launching a new course for dog trainers, um, paraprofessionals, behaviorists, hydrotherapists, anyone that's interested, to actually be able to look a little bit more beyond the obvious and look at the more nuanced areas of posture, which we're not teaching people to be able to do the full assessment, of course, because it's just 3 or 2 3 hour sessions, but it's giving you the opening to where to look and to trust what you see and then interpret it from that point on. So it really does give you such an insight into how the dog is feeling, and which of course could reflect through into their behavior and all sorts of different aspects of their life. So it really is a very, very useful skill to have.
So let's just focus in on the course a little bit then. What was the motivation to start thinking about doing this? Because of course, as you say, the the Galen Myotherapists, they have very intense training over a long period of time. So it's not to replace that, but it is a case of giving, like say, other animal care, dog care professionals to fine tune those observation skills, look at the nuances, and also be able to evidence base better to other professionals. This is just based on what I see. So obviously that's part of it, but give us a little bit of the kind of history of how this built up to wanting to provide this course.
Well, I think it's mainly because we've been lucky enough to actually cross paths with some amazing dog trainers through Turid, through Nordic, through yourselves with the behavioral side too. And I have felt their frustration of knowing that there's something wrong, but they can't quite get to what it is. So they know something's wrong. So they are observing and they are seeing it from their perspective, going, but I can't quite work out why. I can't get any further than that. And then layering it with that physical side, because of course, so much of behavior is totally driven by all sorts of discomfort or pain. And physical pain, and of course, soft tissue pain is right up there. It's so common. So if people could have an idea of what may be underpinning, whatever it might be, a lack of being able to learn, behavioral problems, then they can redirect the dog to have that appropriate treatment based on what they're observing. So it really does help that dog get treatment, appropriate treatment, quicker, and also helps the professional feel like they are looking after that dog to the very highest level, which I know everyone wants to do.
And of course, as you say, there are challenges around soft tissue, especially when we think about vets who have maybe 10 minutes in a not very big space with a very stressed animal. I think there's a lot of value, I think, for a lot of different dog professionals who can provide more evidence on the evidence-based side of things, because we get the luxury, especially on the behavior side of things, we could have a couple of hours with the dog and we can see the dog maybe in a place where they're more relaxed anyway in the first place.
Yep.
So it allows us to share information with other professionals there, doesn't it?
Exactly. And we are going to be running a CPD for veterinary surgeons based on posture and looking at the fascial connections and everything, which is also within the dog trainer behaviorist CPD too. But I think the thing that really just validated all of this, I was very lucky to be invited to go to Brazil to speak at a conference on pain and behavior. And a lot of the audience were veterinary behaviorists, and they were incredible. And I want to invite them to speak so we can hear what they've got to say too, because they've got some really interesting cases that they're working on. The cooperative care and everything is wonderful. And they said to me, but this posture, along with the other observations too, is a missing cog in what they need to know when they are assessing a dog from a clinical perspective, with underlying deep behavioral issues, whatever they may be, from aggression to anxiety to whatever it is, to just having a better idea of what might be going on physically. So that was another amazing experience to be lucky enough to be part of.
And what's wonderful about what you've done with Galen Myotherapy, a lot of the things that we discussed in our previous chat. So check out my previous chat with Julia on the Dog Centre Care YouTube channel, because that sends a lot of the kind of foundatory information on this. But a lot of it was a case of because it was so different to how people were perceiving dogs and you know, looking at movement and looking at things and understanding of pain. Because over that period of time, you've been able to evidence base yourself.
Yeah.
And actually say, well, actually, this is not just a study on a few, it's a study on many, and we can see these things. And that must be important now for those conversations with the vet community, I would guess, and those who want to see something more foundational.
I still think we've got some pretty serious barriers to break down. And it would be lovely if we could just have the opportunity to break some of them down. But we're not going to stop. We will keep going because, as you say, something like posture, especially when you've got the before posture then an after myotherapy treatment and an after posture, it's pretty demonstrable that it really has improved that posture and that dog's life and the behavior and everything else. So yes, we've still got a lot of work to do there, but it was lovely to go. And it's strange that you have to go to the southern hemisphere to really, they go, wow, this is amazing.
But you know, I think if we could get you in front of more of that that professional community in different places, I think they would do the same. And
Well,
what
it
was
would be
interesting
lovely.
at the London Vet Show, where from a pet remedy point of view, was why I'm there, was there we've made a big thing about emotional well-being matters. Amber Batson talks about emotional well-being for patient
Yep.
care, and there is a bit of a gender bias here, do you have to say? The majority of people who came to our stand were female vets or vet nurses,
Yeah.
but they
Yeah.
get it. They really get it. And I think it's
Yeah.
just getting. This is what I think is such a good idea to have these kind of smaller, kind of bite-sized courses, really, because more people can understand it more. It's a way
Exactly.
in. Yeah. Well, let's get
Exactly.
into it then, shall we? Let's get into thinking about why posture is so important and what we can gain from these things, and what the course is looking for us to do for us professionals who want to have a bit more of an insight.
Okay. So, I mean, basically the course is 2 3-hour sessions. This is what you would like to know a bit more about the course, or do we want to have a look at Arthur? Should we look at
Well, let's do
Arthur
a
in a
little
minute?
bit about course first, and then we can go
Okay.
into looking at the practical side of it and why it's so
Sure.
important to understand about posture and what even just an image can tell us, let alone being there with the animal.
Absolutely. Well, a photo, lots of people have said, well, how can you tell so much from a photo? It's a moment in time. And I say, indeed it is. And that's what it is. It's a moment in time. And we like the photos that are non-lured, so a relaxed picture of a dog that's just standing, because posture is an authentic and honest way of a dog presenting their physical form. They can only stand in a way that is comfortable for them. And actually, some dogs even find it difficult to stand. So they very often just move around. And that's something too that people often don't realize, that it's difficult to stand. So it's a very honest way of reading a dog's self-perception of their physical state. So they have to position themselves so they can stand on all four legs. And very often that balance is not on all four legs, it's shifting one way or other. So we look for signs, and there are other signs that people look for, like the coat and things like that, which is great. But we start at the feet and work up, because all the load's going through the feet, and that's where you can really see what's going on. So there are lots and lots of things that we look for in the feet, both position and the toes and the nails and all of those things, because the whole of that dog's weight is going through their feet. And then we look at other things like their top line, their head carriage, which often mirrors the tail carriage too. And we look at their top line and bottom line, because again, often their ventral line or their bottom line over their belly is not really looked at. And that is so relevant to how their top line is, because sometimes when they're protecting through their lower back, which obviously is a common place, they actually drop their belly. They can't hold those abdominals in. So of course, then the whole dog has lost any form of real stability. So we actually go from nose to tail, and the nose can show so many things. I mean, you should see some of the odd symmetry on some dogs' faces, to their ears. I mean, their whole visual sort of eye appearance and their muzzles, that's quite well looked at by a lot of people. But then you go all the way to the tail. And honestly, the tail is an area that still there's a lot to be discovered about. It's not just a wacky thing on the end of the dog, is it? There is so many different things to look at. So we've got quite a few different observations of the tail. And then, of course, from symmetry, muscle symmetry, global muscle domination, which is when the dog is very unstable. And so these big dominant muscles go, right, I'll hold you up. But the littler ones, or the smaller ones that should be holding that dog in a nice, gentle, flexible, but stable position, are just non-activated because of the exercise or an injury or whatever it might be. So it's looking at balance and symmetry. And as I said, that is what shows throughout the whole dog. Every part of them reflects that. So this course is really, it's a bit like you can't start anything unless you know the question to ask. So this is offering a way of asking questions. So it's a start point for learning. Then when you've got that start and you've got the confidence to perhaps go, you know, I thought that. I thought that. Now that does link with that. And it is then like building a huge puzzle. So maybe the course will provide you with a good outside and a few middle bits. And then you start applying that to dogs that you see. Then you can relate other things to that, like their behavior, their movement, and other things. Then you start really building that puzzle and building that whole picture. Because in the course, we actually use live cases. It's either the people that attend dogs or cases that they're working on to try and make it real. Does that give you a bit of a...
Yeah, my God, I'm
You know, I never stopped talking. You know...
Well, no, but well, we never stop listening, so that's a good thing.
Oh.
That's a good thing. I'm just really excited about this because I'm going to be doing the course myself next year, and I'm really excited. I can't wait. It's going to be a great way to start the new year. And I think it also allows people to build some confidence up in their own observations, actually.
Yes,
To
yes.
feel, do you know what? This is just what I see, and not necessarily make a big thing of that, but it's just this is what I see, and to feel empowered to be able to share that.
Yeah, we all need validation in that. And there are some really, really talented people out there. And I do feel sometimes we reach this block because we know there's something more to learn, but we don't really know what it is. So it's about, as you quite rightly said, giving confidence, giving validation to those people to learn a bit more. And then they will learn more and more. And if there is then huge demand or whatever, people say, no, we want the next level, then that's great. But we thought we'd start with this. So the course is, as I said, really on the second session, going through all the case history dogs. The first session is looking at fascia, looking at myofascial connections, looking at why that's so important and how that influences posture. We're all very hung up on the skeleton. I mean, it's pretty important, it holds us up, but it's actually the myofascial connections that can rearrange or arrange the skeleton. So a lot of the skeletal issues are quite often secondary to the soft tissue issues. So to be able to understand posture and how also easing the postural dysfunctions can make such a difference to the dog as a whole, from not such from the physical perspective, but from every part of that dog's life, like it does us, from behavior to digestion to everything. Now that the course we're doing will not cover that. It's just looking at the observations, but it is understanding or going over why we are connected right the way through, and one part influences every part.
Yes, and I think we're understanding more and more now about how our internal system talks to each other, and how there's that communication all the time, and how important the sensation of tension is as part of that communication process internally.
Yes, absolutely.
Just tell us, it's a big topic, I know, but for those who are unaware of or not sure about fascia and what it is and why it's so important a consideration, can you share a bit on that?
Yeah, I'll try and, it's obviously quite complex. So if we divide it into two, superficial fascia and then deeper fascia. So the superficial fascia is basically, and for any scientists out there, I'm making this very top line, that sort of goes below the skin. So that is the skin, then the fascia, then the fat, and then the muscle underneath that. So superficial fascia is really important because that can create tensions, which then creates coat differences and coat realignments. And a very a good technique that we use, which is skin rolling, can help ease that fascia. So the superficial fascia is a bit like wearing a a shirt that's too tight, and you can't lift your arms up because it's just too tight. And that's how that feels. So that's a superficial, but it's all, every part of the fascial connection is connected. So the superficial is connected to the deeper stuff. But the deep fascia, really the easiest way to look at it is, if you think of ligaments join bones to bones and tendons join muscles to bones, fascia joins muscles to muscles. So muscles don't work in isolation. They work in groups to form functional movement. So one muscle could actually provide forces that go in different directions because of the fascial connections. So it's a very fascinating and deep subject, but that's sort of basically what it is. So it holds the whole body together, the whole body together. And as you say, fascia is the main communication between the whole body from nose to tail.
And is there, from a veterinary science point of view, from vets who go through veterinary school, is there much attention paid to that? As you know?
I'm not sure that there is. I think there's more now. I think there's some ancillary learning that's being brought into some veterinary schools. It's something that I think we should be looking into. All I know is a lot of anatomy books are going to have to change or have a very large new chapter in, because it is a new system. I mean, it's been now scientifically looked at from the human perspective a long time ago, and now people are doing some amazing work in the canine as well as the equine. But of course, we're more akin to the human connections than the equine. So, and equine is sort of the go-to after human generally, but the dogs are now being looked at, which is great. But there is definitely more that needs to be done to make this more widely understood and given the credence that it needs, because it is absolutely a vital part within our whole working.
The reason I asked that, of course, is because of many behaviorists kind of listening in will know of the friction there, because many vets have a bit of orthopedic bias, and that will be the go-to thing. So if that seems okay, then the dog is okay. And I rely a lot on, I've got a great physio colleague who's really interested and knowledgeable about the myofascial system, and is able to look at some of these areas and is my come forward back really.
Yeah,
it's pretty obvious the dog is uncomfortable.
Absolutely.
And it's great to have the orthopedic stuff checked and think, well, actually, it's not mechanical, which is
Yep.
great. Good to know. Okay, interesting. Good. Okay, well, let's hope so. And I think the more these things come online, the better. And
Absolutely.
it isn't that big a leap. I think one things we know from the behavioral point of view, my kind of bias is thinking about the psychology of a lot of stuff, but we know that a lot of the things we learned from animals in the first place, actually. So
Exactly.
behavioral science has gone full circle, really.
Exactly.
It's not a big leap to think, well, if we can think of it, even just for ourselves, we know what it feels like to have those kind of, like you say, those kind of myofascial twinges and discomforts. We know how that affects us, but we have more agency. We can sit and rest. We can take some pain relief. We can alter our daily activities.
Also, we can be quite ignorant of where it's coming from.
No, it's interesting.
Because wherever we feel the pain, it could be originating somewhere else.
Yes.
So there's a lot of that. And that's a lot of what we're doing in our level 5. That is very myofascial biased on everything we do within the rehab on the level 5, which is really interesting. So yeah, we'll see. It would be lovely if it gained more traction. It really would.
I think a lot of behaviorists, especially the behavioral community, get this because we see it. And I've watched so many cases where the answer actually ended up being in that kind of area for that animal. And when that had been addressed, then we saw the changes.
Yeah.
So I think we do see it as a community. We might not understand it. We might not fully get it. And I think if you're very lucky like I am to have a colleague like the amazing Kate Davey, who's my physio colleague, who I can get to look at things in that way and process. It's great. Many people don't have that though, of course. And,
no, exactly. And it is, and that is something that's very difficult, because there are so many of these great seminars that are out there that are giving people a lot of really good knowledge at the sort of the guardian level, and then they're seeing what is being done from a professional level and going, I'm not sure, but I'm not happy with that, but I'm not sure why. And so we need to bring the knowledge base up of this, because it is critical to understand, and to understand the animal in the whole. And that's why working with people like you, and when I was in Brazil with these veterinary behaviorists, and they're saying, well, vets should have more training in behavior to be able to understand and then be able to do this incredible cooperative care that they're all doing, which is utopia,
Yes,
isn't it, really?
and that's the friction. I think this is something I've talked about myself before, but
Yeah.
I think for a long time, many different professionals, regardless of the sector, thought they knew about behavior. In fact, they just knew how to make others behave. Now, and there is a difference, of course. Now we're stepping, I think, actually, we need to understand the behavior,
Yeah.
and allow animals to behave.
Yes.
I think this is the key thing here. And that does come back to observations again. I think that's the big key.
Always.
When people ask me about how I work, it's about getting good observations. And
Yep.
so that's the wonderful thing about this course. So we'll make sure that we share information about the course, of course.
Thank you.
So let's have a look at a case, shall we? So I sent over some photos of my dear Arthur. So people who follow me know Arthur's our older boy. And he's got a few bits and bobs going on. And we had a chat before we came on, of course, and your insight was remarkable, as we'll find out, I'm sure now. But and just to let people know, I didn't share anything with Julia about Arthur other than the fact that he's my dog, and beforehand. So this is all done purely from these still images. So shall we bring Arthur up?
Yeah. And you most certainly didn't say what a beautiful soul he is.
He is the most beautiful soul. He's my boy.
He really, really is. I mean, the moment I open the first picture, I must say, when I do the distance support and I open the first picture and I see these gorgeous dogs, quite from my heart just goes, oh, what a beautiful dog. Right, so here is the lovely Arthur. So Andrew very kindly shared some photos with me. So we always like to look at the lateral shot. So if I just let everyone just have a look at him from the right side and then from the left side. His markings are wonderful, aren't they? Absolutely wonderful. I mean, when you look at that. Beautiful markings. Now, this picture is not so we can look at his markings. Looking at his top line from this view of all dogs is often an angle we don't look at. And sometimes you can look at a dog laterally and go, okay, I can see something, but it's not until you get on top like this that you can really see things. So I just thought I would share those pictures at first before we sort of go through in any detail. So this is the side that I'm going to just look at first. Now, I think it's fairly obvious that this lovely, lovely boy is just lacking a bit of drive from this back end. He's obviously struggling a bit in the back end, but that's not really where I wanted to target, because I didn't actually think that that was his main issue or the main area that I wanted to go. But I just thought I would mention that for me, and looking at how his feet are positioned on the ground, the toe splaying, the flatness of his feet, this foot is really offloading onto his left hind here. This one is putting a lot more weight through his left, but also onto his left forelimb too. And you can see that by his angle through his paw. So that was the first thing that I looked at. So I try and do it I tend to look at the dog as a whole and then see where my eyes are being drawn and then try and drill down. So he's definitely overloading from his back end, primarily from my observations onto his left fore, but also for something else, another reason that I'm going to talk about in a minute. He appears to be offloading from his right fore onto his left fore. So that poor leg is taking a lot of load and a lot of weight that's being distributed onto that foot and leg. So if we look at him from this side now, we get a slightly different view, but also I think, I'm just thinking that the photo, he was pointing one direction and asked to turn, and he's just sort of in the process of reorganizing himself, which in itself is a very interesting observation. But one thing that I wanted to really concentrate on, I mean, we can look at the orientation of these feet, but I wanted to look at the angle of how he's holding himself through his forelimbs. And to me, he's just a little bit too ahead of himself. So his feet are just a bit too far forward, which means he's taking a lot of load through his carpal joint. Actually, think I can see a lick mark there, but also through his back pads. So that's a lot of load going through there and here, which of course would be transposing up to his shoulders. But this is where it's sort of really telling you what's going on. So what's happening here is that he will be losing some of the integrity through his tendons in his toes. So his feet will be getting a bit longer. So the toes look quite flat. So look at him from the other perspective. Both of his feet are actually loading primarily on his back pads, which is unusual. Obviously, every type of posture is unique to that dog. And I think sometimes people think, oh, yes, I can see posture, I can see it. But it is so nuanced because every postural function or dysfunction has come from a whole unique set of conformation, injuries, accidents, repetitive strains, whatever. So it's unique to every dog. So the common are common, but there's also anomalies too. And he is a bit of an anomaly. So I'm concentrating on these forelimbs here, but also you can actually see from this perspective the load that is going through his carpus or wrist here, which is not really what he was built for. His legs were designed to stand much more in that angle, so it's much more of a pillar. So where I was really heading was, why has he got such an extended neck? Because generally when dogs are offloading from their pelvic region onto their shoulders, forelimbs, they tend to pull their neck in to actually gather everything up to use that within the drive, including their face, their cheeks, everything. But Arthur has got a very extended neck. So I found that unusual. So I wanted to explore that more. So for me, this is the one area that is actually he's using to pull himself along, because I don't think he's using his neck very much, because otherwise it would be a lot shorter and joined up so he can actually use that as one unit. So from my experience and what I can see in Arthur, it felt to me like he had an issue here, deep in his lower neck. And this area here would be very overworked and quite inflamed potentially, because those are the main muscles that he's using, because his bottom line here, his ventral line, also isn't very tucked up. So he's not using through this ventral line very much, maybe not through his pecs. So this would be sore, but this would be the area that I think he would be trying to avoid using most of all. But also, he's got his head, in every photo, he's got his head on a slight right tilt, but also slightly tilted to the right too. So going to the right and slightly tilted to the right, which again puts even more load on that leg too. So that left leg is doing a lot, but Arthur's in wonderful condition. So at least he doesn't have extra weight to hold on to as well, or to support. So this is where this also is a useful angle, because you can see the symmetry. And here, where I really wanted to highlight, you can see here, he's got the tilt to his head too. Now, I didn't know any of Arthur's history, but I do see dogs like this. And sometimes it can be an injury, but often if they've got a tilt like this in the head, it also reflects through another part of their back. So that was a bit of a mystery to me. So I just thought I'd show you these pictures again, so maybe you can start looking where I've sort of put the annotation in the previous picture. But what a beautiful boy. What a beautiful boy. And that was my assessment, Andrew.
Well, thank you. And I think just to let people know a little bit more about Arthur. So he's 14 years old. So he's an old boy. You wouldn't think it from those images, but he's a very determined dog. He does a lot of stuff. People who follow me on my husband and I on our timeline see the adventures that Arthur gets to. So nothing's going to stop him, right? But we've been on quite a journey. And actually, it's interesting you mentioned that, because one of the first things we noticed ourselves with him was that he started doing a lot of licking on those front legs. That was the first thing we went and saw John, our vet, about, because we thought that that might be indicative of something. Anyway, he's got spondylosis, and it's interesting that we went through a period where you could see when he was fusing.
Things were fusing in his lower back. Is it the spondylosis?
Yes.
Or is it throughout?
No, it's the lower back. Back. Yeah. He's got arthritis as well. I think there's definitely been some changes about how he's overcompensated on those front two over time, and that's how a lot of the strain comes, because as you pointed out, I think either before or then, about how he just stand very much on his pads, very kind of flat. He's also had thyroid cancer, which was we thought we were going to lose him, but our vet was amazing and managed to cut that out. But that's left with a lot of tightness around the neck, actually, because of what's been removed. And then finally, sadly, he's got a heart murmur as well, bless him. So he's got a 2B, grade 2B heart murmur. And he's got a brain tumor, which is something new. And that, I think, really does fit some of that thing with the head. I think could be compensatory because of the spine, but also he acts, one of the things that we picked up on that, but before we got that guy looked at, was he kind of acted like he had something in his ear, because obviously there's pressure there. He is on under the vets, amazing vets, and medication. So he has more pills than me, and I have quite a lot of the moment. But they're all good things. They do good stuff, and they're giving him a good quality of life. We can tell some days. I think this is important for anybody who's got dogs with chronic health things, and as you try and support them. Some days are better than others for him, and we can't remove all pain. I think this is the key. We have to recognize that we have to do our best as far as we can do, and check in with our dogs on a daily basis to see where you are, how are things going, and just kind of think about that, because even for us as we get older, I think we have a level of discomfort, and we do kind of adjust to that, as do our dogs. I think what we don't want to have is the dog to be suffering, and I think we've got Arthur in quite a good place at the moment. But your observations, as I say, a lot of people would look at the back end stuff and stay there, probably because there's a lot to see at the back end with it. But it was interesting that you were drawn into the neck and the head carriage and the leg. I think this is the nuance that you were talking about.
Well, the neck's everything. The neck, it commands the movement. So if your neck is compromised in any way, it's going to have an instant effect, and not just on your movement, but the whole fascial connection. So it's really important. If we can't do anything else, we can just aid the neck potential, then that's huge. So yes, the neck, it was just when there is something that doesn't look like it's a normal presentation, then it is about finding out what is it that's actually underpinning that's not creating the normal presentation.
And there's likely to be things that we haven't identified for him, of course. You can't. I think over time our vets have, and also because we make a point of really being with our dogs, if you know what I mean, as in feeling them, and when we have those moments of affection, not only having that as a chance of touch, but also to feel them and see what's going on, and also do a lot of observations. I'm the worst one, because because of little knowledge is a dangerous thing, Julia. So I think you think, oh my God, is this or is that? And because my husband's a healthcare professional himself, he's a little bit more nuanced about it. Because you can see things on there. But so we do check these things out. But I think Arthur is definitely a sum of all these different things. And like you say, having had that, that will affect this, and then that in fact will affect that, and that will affect this, and it's just
And of
finding a
course,
way
scar
to
tissue is going
Mm.
to really, especially under here, is going to have a big effect on all that movement, um, and how everything connects. But
knowing a bit more
vital
about him.
operation.
Yes, and knowing a bit more about him, as I said, I didn't share anything specifically with you. You just took it off the images, but now you know a bit more.
Mm.
What does your gut tell you about that elongated neck? What's the purpose of him having to move forwards a bit like that? Is it because there's something directly with that have ended up with those shoulders, or is it another byproduct again of maybe him wanting to stretch his spine out a bit, or because of the
I,
uncomfortableness of the
I
operation?
feel that I feel he's uncomfortable in his lower neck.
Mm.
That's where I'm going, and I feel that if if his neck could be just given, I mean, I can send you some videos to help you just give his neck a bit of a massage, just to help him, because if he's holding his neck in that position and he's having to use everything to move, he's going to feel uncomfortable there. So I think that would be where I would target absolutely straight away. And that also, neck issues do reflect down, in my experience, to the licking of the feet. It's not generally directly where it is. That's a referred discomfort or pins and needles, or whatever it might be. So I will send you something.
Thank you. And also, it's interesting for us. We've noticed before when he almost seeks out places to rest his head.
Yeah.
Which is interesting. Great. Well, thank you for looking at him. And as I say, he's my boy, and we love him. But
He's lovely.
and as I say, for a 14-year-old, despite all that stuff, it doesn't stop him wanting to live life
No.
to the full. Okay. Well, it's been amazing, Julia. Thank you so much for sharing that, and also taking time to look over Arthur and share some of the things that this course is designed to do. Really, is to look at these observations, think about the things that might be connected, and to give us different professionals the chance to be able to fine tune those observations and be able to evidence base it more.
Absolutely.
We'll share information on that, but just tell us a little bit about how it works then. And, is it limited numbers per course? Is it an open course? What's the actual course structure again?
There are 8 people per course, because it has to be interactive or interrupted.
It might be both. Yeah.
Interactive. You know what I'm trying to say. Interactive. That's the word. In a long day. It's going to be interactive, and also we need to discuss. I love discussions. I don't want to just be didactic about the whole thing. So just 8. There are 2 3-hour sessions, and they're in the morning. So they are between 9 and 12. So it's difficult to know when these times fit. So the first session will be primarily looking at the theory behind it, myofascial connections, how the skeleton fits with everything else, all of those really important underpinning stuff. And then the next session is about looking over all these dogs. So it's posture, 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 posture. So we'll be looking over a lot of dogs in that next 3 hours. And then if anyone really did want to do this, when we run a course, we like it to be validated. Is that the right word? But if anyone did want to then go on and take an assessment, they could then become a foundational postural analyst, which is Galen trained, which I think it's nice for people to have that, so they can actually say, well, look, I can take what I do and take it one step further and give your dog more of an observational analysis to submit to, as you say, other professionals or vets or whoever. So that's it. So it's 2-3 hours with an optional further assessment if anyone wants it.
Brilliant. I think this is going to really be very very popular and oversubscribed, I'm sure, of these, because I'm just really excited to get started on it. And
really kind. Well, we hope so, because it's one of our big guiding principles is sharing knowledge, and it's what we all should do, and not sharing yesterday's knowledge, sharing today's knowledge and tomorrow's knowledge. That's really important. If by any chance people do try and book and it's not available because it's been filled up, which would be wonderful, there will be more dates. So all you need to do is just send us a message on the website and we'll issue some more dates, which would be a wonderful situation to be in.
Is it up on the Galen Myotherapy? It is, isn't it? Now is there, isn't it, for
It,
people
it
to?
is. You've actually got the link, and the link
Yeah,
should be there under furthering my expertise.
great. Okay, great. Well, do you know, you're such a gift, Julia. I think I know you'll be too humble to probably agree, but I can say it for you. And I know so many people have been influenced from you. So even when I was with Cindy on Monday, you've had a big impact on her own
She's a wonderful woman.
outlook. And you met in America, I think. Is that right? Is that right? Yeah. So how does it end up
Yeah.
in? Yeah.
And we met and we said, we're going to work together. Within almost minutes of meeting, it was that sort of connection. Yeah.
Aren't they special? I had the same with Sarah Fisher, actually, years ago. We just kept bumping into each other, and Sarah said to me, "We're gonna get to know each other," and we kind of did. Maybe it's a self-fulfilling thing, but who knows? But yeah, I
Yeah.
think
Who
it's
knows?
amazing. And
Who knows?
well, I really appreciate that your willingness to be so generous as you've
Oh,
done tonight.
well,
And I think this is a great way for you to think about how you can give people that kind of step into what you do through these
yeah.
courses. And I think offering it to the veterinary community as well is great.
It would be
So
wonderful. Yeah.
thank you very much. Thank you, everybody, for tuning in
Yeah.
tonight.
I haven't
Wonderful
can't
time.
see you all, but thank you. Yes.
Well, we've had a great turnout. So, and we'll have you back, of course, Julia, I'm sure. Just to let everybody know, the next chat in the group is Joe and Ragnar. So, Joe shared part of the Ragnar story in the group, and many people were moved by this dog. And a real example of initially trying to kind of do the usual stuff, but then realizing that the dog needs to let us know their own version of safety and share the beautiful video. Oh my God, everybody should see it. So I thought we'll get Joe in the group, Julia. So Joe is going to be here on Monday, 6:30, to share that. It's a real life, real story. And I think they're
Love
the most
those. Love
powerful
those.
sometimes, aren't they?
Yeah.
Yeah.
I tend to blub when I hear those.
Oh God, I think we all do when we saw the video.
Mm.
It's like the kind of video you see on like Children in Need or something when they show
Mm.
you video of things, it has that vibe to it. It's a really good video.
Yeah.
So that's on Monday, 6:30. Please come along. Thank you all for tuning in, and thank you again, Julia.
My pleasure. Thank you very much for having me here. Thank you.
Bye, everyone.
Bye.